Okay. So, Mark, can you tell me a little bit about how you've been feeling in the last few weeks?
I've been feeling pretty positive, a little overwhelmed at times. I got a lot on my schedule. I'm working, uh, interning, and raising a family. And so, yeah, but I've been trying to practice good self care to keep it all together. So but to be honest, it's been a little overwhelming recently.
Okay. That's fair. It sounds like you have clearly a
Yeah,
lot on your plate.
I do. I do.
So I'm just going to walk through a few assessments with you. The first one is just a depression inventory. And this is kind of a way for us to get some more baseline information about where you're at,
Okay.
and just to sort of assess your overall kind of mental health currently. So to begin, I'm going to be using the Beck's depression inventory with you today. And there are 21 different groups of statements that are listed. Each one will allow you to, give some varying degree of where you're at in terms of things like sadness and pessimism and things like that. So I'm just going to go down them and read them off for you so that you can kind of answer them to the best of your knowledge or your ability. And we'll just kind of go from there. Does that sound good?
That sounds great.
Okay. Wonderful. So how would you describe your level of kind of sadness? Do you feel sad? Feel sad much of the time, all the time, or so sad you can't stand it?
I'm not sad a lot.
Not sad a lot?
No.
Wonderful. And your pessimism, would you say that you're discouraged about your future? Or maybe more than usual? Do you expect that things are going to work out for you, or do you feel that your future is hopeless?
I'm
And won't
definitely not pessimistic. No.
Okay. So you're not discouraged. And your past failures. Do you feel like a failure? Do you feel like you've failed more than you should have? When you look back, do you see a lot of failures, or do you just think that you're complete failure?
Well, there's probably like a couple early relationships that I probably could have done better in.
Okay.
But looking back on it, like, I don't know.
So maybe not a lot, but you feel like maybe there are some there, or.
Yeah, I know.
But you don't. Do you feel like a failure?
No.
Okay. And then what about loss of pleasure? Do you find that you have had a decrease in enjoying activities? Or do you find you get as much enjoyment?
Maybe a little bit with like all I've been doing with my work and school and the kids, the family, and working full time, interning. I'm kind of in a grind right now, so a little bit.
So maybe you don't enjoy things as much as you used to?
I need to enjoy more things more often. Is that a way to say it?
You do or you don't?
I need to.
Oh, you need to. Okay, so maybe we'll just mark it as one. And what about guilt? Do you feel like you have feelings of guilt about, I don't know, things that you've done or that you should have done, or do you experience guilt?
No.
No? Okay. And what about punishment? Do you feel like you should be punished for things, or that you're going to be, or
no?
Okay. And how do you feel about yourself? Do you like yourself? Do you feel like you have confidence? Are you disappointed in yourself? Or do you genuinely kind of like yourself?
That's like a loaded question. I think I'm pretty cool. No.
Okay, it sounds like it's
no. I think overall I'm a pretty well balanced individual.
Okay, that sounds good.
Yeah.
And so the focus on this inventory is to sort of just look back at the last couple of weeks to see if there's been any changes in these things. So,
Okay.
do you find that you have been more critical of yourself in the last 2 weeks than normal, or everything feels to be kind of the same as it has been for a bit?
Pretty much the same.
Pretty much the same. Any suicidal thoughts?
Nope.
What about crying? Do you find that you cry a lot, or?
Only in really sad movies. Or I see that commercial with that lion that's abandoned and
Oh,
got a thing trapped on his foot. But beside
very
that, no.
substantial.
Yeah. Angel.
And do you get agitated pretty easily, or you are restless? Have you found that you've had a loss of interest in activities in the last 2 weeks?
Yeah, I have. Yeah. I felt like I've been in like a grind and I got to get my motivation back.
Okay.
It's like I said, it's been working full time, internship. I interned Monday, Tuesday, Wednesday, Friday from 9 to 12, and on those days I work 1 to 8, and on Wednesday I work 2 to 6, and on Saturday I work 2 to 6, and then so I have off Sunday.
Yeah.
And I have 4 kids.
Wow. Yeah, I mean, I don't have kids. I don't have a family. I don't have to manage all of that.
So
But
I don't even know how. I don't even want to drop that on you, but that's just kind of how it's really tough right now.
Okay, but it sounds like, I mean, you just have a lot on your plate, but it's not.
Yeah.
Not noticing any major differences in the way you're clearly able to still do these things.
Yeah, I
maybe less interested in some of the things than before, but it's nothing that's really too. And in indecisiveness, do you find that you're having a harder time making decisions? I'm sure you're exhausted, but
not really.
no. Okay. Do you feel worthy? Are you feeling any feelings of worthlessness?
I definitely feel worthy.
Wonderful. Any loss of energy?
Oh, like 110% loss of energy. Yeah, I am like half the man I used to be.
Okay.
I don't get enough sleep. Don't whatever. Yeah, but I'm doing all right.
Okay. So maybe less energy than you used to have.
I have less free time or any whatever time that I used to have.
And your sleeping patterns, you said that you're sleeping a lot less than usual?
Yeah.
Are you finding that you're more irritable at all, or?
Yeah.
More irritable? Okay. So much more than usual, or just?
Yeah.
Okay. Are you all the time?
No.
Okay.
Just in the mornings before I have my coffee.
There you go. And changes in appetite at all?
No.
Okay. What about concentration? Are you having a harder time concentrating? No? Okay. And then are you feeling tired or fatigued?
All the time.
Sounds like you were tired all the time. Sure.
Constantly. Yeah, that would be all the time.
Are you too tired to complete things though? Like, are you still getting things done? Are you finding that in the last 2 weeks?
I'm getting things done.
Okay. Okay. I suppose this question is a bit more personal, but it is something that we like to address. Are you having any loss of interest in sex?
No loss in sex.
Okay.
Yeah. Probably an increase.
Oh, there you go. Okay, so after completing that, sounds like for the most part you're functioning well, although you're obviously very tired and you have a lot on
Yeah,
your plate. This is, like I said, just sort of a way to gather some baseline information. So in scoring it, it's pretty easy inventory. We can just sort of add up your scores now, and from the looks of it, it doesn't seem like you're having any real struggles with depression at this point. So
that's great.
that's great.
And it's good news.
That is always good news. And then the next assessment or inventory I like to look at is anxiety, just to see where your anxiety levels are.
Oh, geez.
I'll be using VEX again for you. So with the VEX inventory, it's somewhat similar in that you're sort of assessing for symptoms that you might be having. These are some of the more common ones that we'll see with people that have anxiety or that are dealing with that. So basically, I'll just have you indicate how much you've been bothered by any of the symptoms in the past month at any point, including today. So the scale is that I haven't had these symptoms at all, mildly, moderately, or severely. So it's kind of your range. So for any numbness or tingling that you've experienced.
Okay.
Maybe not. Have you experienced any numbness or tingling?
No.
Maybe nothing that's apparent to you. Okay. Feeling hot, out of the ordinary, not something that.
No, I'm not feeling hot.
Okay, not feeling hot. Any wobbliness in your legs?
No.
Okay. Have you felt unable to relax?
Sometimes, yeah.
So maybe mildly, but it doesn't bother you too much? Or is it pretty moderate and it's unpleasant at times?
It's like moderate. Like I have a hard time relaxing. I got so much going on. Like, how can I not?
Right. Yeah, you're having to kind of keep yourself mentally awake for all of it. Do you have any fears about something bad happening?
Like people killing me?
Well, that could be one option, or just overall just worries of something bad happen that might happen. No, okay.
No, I don't. No, nope. I'm good
So
there.
any other, I'm just gonna list maybe some other like physical things that could occur, physiological things. Maybe just let me know if any of them are in there. I'll just read them off.
All right, I'm a little nervous. Go ahead.
Dizzy or lightheaded, heart pounding.
From what?
Nothing. That's nothing in particular. Just do you find that you're having these symptoms that kind of come without
gotcha. Not in a particular situation.
Okay.
No.
Okay. Or feeling unsteady, terrified, afraid, no. Nervous?
No.
No. Choking feelings, hands trembling. Okay. Any shakiness? Sounds like maybe no shakiness.
I feel a little shaky sometimes, but not in general. No.
Okay.
When I'm watching the Eagles, I feel a little shaky.
Are you in Philly?
Yes, I am.
You are. One of my best friends lives there.
They're awesome. Are they an Eagles fan?
Yeah. Yeah, she's sort of an Eagles fan. She's a Packers fan though. Her family's the Eagles fan, but she's converted to Packers. I think her grandpa used to live in Wisconsin.
That might change the whole testing here.
We're testing you. That might. Are you feeling shaky now?
Very.
Okay. Very. So no fear of losing control. Are you having any difficulties breathing or feeling fears of dying or?
No.
No. And then what about, so probably the rest of them I imagine no as well. Feeling faint or lightheaded or having indigestion, face flush, hot flash.
Only after I eat like a lot of pepperoni pizza.
Okay, so
But besides that, no.
you kind of do it to yourself. It's to be expected. Comes with the territory.
Yep.
Okay. So that's that and that assessment or inventory works pretty similarly to the Bex one. We can tally it up now and it looks like you are not really experiencing much anxiety, which is wonderful.
That is wonderful.
It's so wonderful. So the last assessment that we're going to go through is the audit, and this tests for substance use, particularly alcohol. And before we begin, I am going to ask you some questions about your use of alcoholic beverages during the past year.
Okay.
Before we begin, I just want to be clear as to what I mean by alcoholic beverage. So 12 ounces of beer should be equal to 1.5 ounces of a distilled spirit, or 4 ounces, or I guess 5 ounces of wine.
5 ounces. What's?
So you're clear on that?
I guess I am. Yeah, sure.
Yeah. Okay.
Thanks.
Yeah. So how often do you have a drink containing alcohol? And we're talking about standard drinks during the past year.
Never.
So never. You never drink. Never. So then if I were to ask you how many drinks and how often, and
I haven't drank in like 8 years.
8 years. Okay. Well, in that case,
the audit's over.
The audit, it might just be over. We may have completed the audit. We may have just expedited the audit process.
Yeah, I've been in recovery like for 8 years.
Congratulations.
Yeah, thanks.
Wonderful.
Yep.
Well, I think that gives some other information and insight. I think some of the other things that we assess for in this is just whether or not people have been injured as a result of your drinking and whatnot. But obviously those things are...
Oh, you can ask me that. You can ask me still whatever you want.
Well, we will...
I'm an open book here.
I feel
like you've done such a better job of interviewing me than I'm probably ever going to be of interviewing you, but go ahead.
I think for the purposes of the assignment, we are supposed to go through the entire thing, but I mean, it's really a matter of checking them off.
You do what makes you happy.
Okay, so
seriously.
Yeah, I'm gonna say that it's probably okay for us to not.
Yeah, I think for the YouTube upload thing, I don't think it would.
Yeah.
But I don't know. You did a really good job.
Thank you.
Were awesome. I'm under pressure now, so.
You're under a lot of pressure.
I am. Can we take a break before I start interviewing you? Like a 1 second break or Hello, Mallory. How are you?
I'm doing all right.
That's good. How's life been?
Life has been insane. Between
a little crazy.
Yeah, very crazy. I work full time and bartend all nights, and then I do full-time grad school, and I don't have much else for anything. I don't have time for anything else really. So it's been very rewarding, but also very overwhelming.
No time for Mallory?
No, not really.
Okay.
No sleep. I don't sleep. I don't really, it just seems like I wake up and I just constantly study, think about this, reschedule this, do all this, and I work all night, and then I wake up and do it again. And
self-care level is kind of low?
Yeah, I'd say it's okay. I think my definition of self-care is it's lower than my normal standard. I am a very active person, so the fact that I don't have the time to do all of my activities and make as many, decisions around that kind of stuff, and I sit on my butt so much because I do so much studying. So I do my I do my best, but
Okay. So overall, what would you say between like 1 and 10, between like I'm super, super happy being a 1 and like I'm super, super depressed being a 10, where do you think you are?
I'd say that I definitely have had my share of experiences on the depressed end of things, but I drift in and out. So overall, I think most of it is just stress management. Maybe I'll say somewhere in the middle.
So
Maybe
you sound like you may be a little bit depressed.
yeah.
Okay. All right. So I'd like to ask you some questions that will help us determine possibly the level of your depression.
Okay.
They're just generalized questions. You just answer them to the best of your abilities.
Okay.
That sound good?
Sounds good.
All right. All right. So, as far as your sadness, how do you feel? From a 1 to a 3, I do not feel sad. I feel sad much of the time. I'm sad all of the time. I am so sad or unhappy that I can't stand it.
Um, Maybe much of the time.
You feel sad much of the time?
Hmm.
Okay. But pessimism, I'm not discouraged about my future. I feel more discouraged about my future than I used to be. I do not expect things to work out for me, or I feel my future is hopeless and will only get worse.
I don't feel discouraged about my future.
So you feel, you're saying you feel sad much of the time, but you're not discouraged.
No.
That's good. I like to hear that. As far as your past failures,
I
do you want me to go through the range of them that they give me here? Or no, go ahead. Describe your past failures to me.
I would say that I don't think I'm a complete failure.
So you feel you're a partial failure.
No, I don't struggle too much with feeling like I failed.
Okay. So what would you say? As I look back, or I have failed. Oh, what's the bit? I do not feel like a failure.
Correct. Yeah, I don't feel like a failure.
No.
No.
Okay, that's good. Loss of pleasure. Do you have loss of pleasure as far as doing things you used to enjoy, doing things as much as you used to, things you used to enjoy, stuff like that?
Yeah, I'd say a little bit.
Why do you think that is?
Um, I guess part of it might just be because I'm so tired all the time and that I have so much going on that I don't have space to do as much as I'd like to. But a lot of it too is just being around other people. Sometimes I get overwhelmed and don't have the same desires to go out and do some of those things like I used to.
What do you mean when you get around other people, you get overwhelmed?
I just, when I'm feeling down and feeling like not myself, it's a lot harder for me to be around other people because I find myself kind of getting irritated um, and uncomfortable kind of in my own skin, which makes it hard to interact with other people. So it just kind of makes me anxious and
What what are you feeling then? What's your emotions?
um,
Anxiety?
maybe I feel irritable, probably irritated more than anything. That I feel so tired and like detached, and I don't have the patience and the energy to carry out conversations and do the things that I want to do. And so mostly annoyed or irritated, I would say, and kind of sad.
Okay. Guilty feelings. I don't feel particularly guilty. I feel guilty over many things. I feel guilty most of the times. I feel guilty all the time.
Yeah, I feel guilty about stuff. Maybe not all the time, but I definitely feel guilty about.
Like what?
I am really, really hard on myself, so I feel guilty about anytime I indulge in things or I give myself a break, which is obviously a healthy thing to do. I tend to feel guilty about it because I'm not maybe achieving things full speed or what it might be. I hold on to a lot of guilt over those things.
Do you think you're
Or
do you think you're not do you think you're not worthy of being happy? Like with doing those things?
no, I don't know that I had ever really conceptualized it like that. I think that I feel, for the most part, worthy. Like I know that I am capable of doing a lot, and I, for the most part, feel like I have that under control. I feel more guilty about like maybe neglecting other people, or yeah, I guess I feel guilty because I'm hard on myself, but I also feel guilty sometimes about the way I can treat other people when I'm too caught up in trying to like take care of my own stuff.
Kind of like Mallory should have a good time,
Yeah.
right?
Yeah, but I guess I don't, it's harder for me to think that she gets to
Why?
because I feel like I have a responsibility to be the always kind of on my game.
Because what?
I said I feel like I have a responsibility to always be on my game.
So it's all or nothing, black or white,
Yeah. Yeah, I tend to be an all or nothing. I'm an all in. Yeah.
all in or all out.
Mhm.
Okay. Punishment feelings. I don't feel I'm being punished. I feel I may be punished. I expect to be punished. I feel I am being punished.
I don't feel like I am being punished or that I should be.
Why'd you stop?
Talking.
Yeah.
Um I cuz I just don't know. I don't, maybe again, a lot of it is just the way I'm conceptualizing it, but I don't feel like,
Do you feel like maybe you're punishing yourself?
oh yeah, yeah, at times, but I don't know that it's a punishment. I guess maybe it is. Yeah, if I have guilt over something, then yeah, I guess I beat myself up.
All or nothing, right?
Yeah.
That, that's got to be a hard threshold to stand up to,
Mhm.
huh?
Yeah.
Self-dislike. I feel the same about myself as ever. I have lost confidence in myself. I am disappointed in myself, and I dislike myself.
Um, I think I've lost a little bit of confidence, but I don't dislike myself. Or perhaps even that I feel the same. I don't know that anything's really changed in that way in the last couple of weeks, so I would probably say that I feel the same as ever, or as I have in a while.
I mean, like, do you like yourself?
Yeah.
You like who you are?
Yeah.
Okay, that's a good thing.
Hmm.
Criticalness. Oh, this could be a good one for you. I don't criticize or blame myself more than usual. I am more critical of myself than I used to be. Well, I'm not even going to read these things. I'm just going to like give the general thing. How do you treat yourself as far as self-criticism goes?
I'm pretty critical.
I know.
Yeah.
I already know that from our
Hmm.
10-minute meeting.
Hmm.
Yeah. You should give Mallory a break.
Yeah, I should. I
She
try.
deserves it. She deserves it.
Yeah, I certainly try, but I think that part of it feels like even when I'm working at it, it still seems to, there's always that other voice that never really goes away.
Yeah, I understand.
Hmm.
I get it.
Hmm.
We're our own worst enemies. Do you have any suicidal thoughts or wishes, Mallory?
No, I do not.
All right, that is very good to hear. Do you cry?
I cry,
I'm sure you do,
but not very often. I find it very hard to cry, actually.
but you do.
I do.
How often?
Not very often, but when it happens, it's pretty intense. But I find that crying can be difficult for me. That's not something that, if I want to, I tend to not be able to.
Okay. So as a result of the little, I don't want to even give it a name, just our discussion that we just have, there's some slight depression in your life, Mallory, which is understandable
Mm-hmm.
and definitely workable. Let's go on to the anxiety scale. The same type of test, same type of questions.
Okay.
Um, and again, these tests are not like pass fail. You know, you win, you lose. It's just gives me a gauge of where you're at and how I can help you as a client, right?
Yeah.
All right. So I think that's really important that you know that. Oh, geez. I guess recording, right? This one's really weird. The Beck anxiety inventory.
Mm-hmm.
Do you have numbness or tingling?
Nope.
All right. Are you feeling hot?
Nope.
Any wobbliness in your legs?
No. Maybe a little bit sometimes if I feel unsteady.
Like when?
Um, I do get a little like moments where I feel like lightheaded, and so it kind of makes me feel like I'm unsteady. So my body.
Like when? Do you notice any patterns?
Um, yeah, I guess when I'm in like kind of stressful situations, like maybe there's been like maybe a few like recently at work when it's been a really really long day, and I'm bartend, so I'm on my feet the whole time, and I really enjoy that work. But there are moments if I'm like kind of in my own head where I realize how like tired I am, and I kind of start to worry that then I'm
Like
like, oh, where am I? And then all of a sudden like I kind of freak out, and then I think
sounds like a lack of self-care,
yeah, potentially.
tiredness, just exhaustion, maybe.
Hmm.
You should keep an eye on that because you said that earlier too, and that
Hmm.
makes you like that tiredness and that exhaustion makes you vulnerable to a lot of things.
Hmm.
You know what I mean?
Yeah.
Um, it can set your emotions and behaviors and thoughts into different directions than it would normally go. if you were mentally healthy and these vulnerabilities weren't active. So
I can see that.
all right, that's my little bit of wisdom there. Unable to relax.
Yeah.
Yeah. Okay. What's up with that?
I'm just a super restless person.
Like you have restless leg syndrome or what?
It doesn't stop. I have to keep going from thing to thing to thing to thing. I'm very
Have
focused.
you been diagnosed with anything?
With like anxiety or
Yeah, or anything that would keep you doing that.
I have.
My next question would be, and we don't have you could like stop recording it. I don't know if you have, like, why and what are you taking? But
Oh, no, I'm not. I have never been formally diagnosed with depression or anxiety, but
like it is my very amateur opinion that you have anxiety disorder.
yeah, and I'd say I'm more on the severe end of depression, but for the purposes of this assessment, I'm not really supposed to dive into that. So I've kept it kind
You're
of.
right. You're right.
Yeah, but I do also, part of mine is symptoms is that I have a digestive disorder that I have been diagnosed with my whole life. I have IBS. I don't know if you've heard of that before.
Is that a throwing up thing?
No, it's irritable bowel syndrome. So it's a
Oh yeah, I know what that is. Yep. And what's that done to you?
I pretty much have intense stomach cramping all the time, and I can't eat like anything. Like there's like
How's that made you feel?
It's just exhausting to have to think about all the time and to be in pain all the time and to have to go through your life, and it doesn't make you feel very good, and like physically or emotionally, and it's just very wearing, and there's no cure for it. So it's just been taking me years and years and years and years to try to figure out the right diet, and having to stay active is really helpful. But with my given life now, I am not able to do that as often. And so
what kind of effect do you think it had on your life?
I think it definitely is where a lot of where the depression came from was because of my stomach.
I'm sure.
I always felt terrible after
you said you had it when? How old?
I was probably like 12 when I first started.
Yeah. Oh my gosh. Yeah. When you're just trying to like fit in and be one of the crowd, and you got this thing that's dragging you down. That must have been difficult for you.
Yeah.
Yeah, I'm sure it was. Okay, so the fear of worst happening.
Yeah, I mean, I guess if it's all just sort of there's a little bit of the panic. When I have those body reactions where it's like I kind of feel like I've lost a little bit of control over what's happening, then there's a like worry that something will happen out in public or something. So there's a little bit of that for sure, but it's not like the worry.
It's when you're in a public place?
Yeah. That's when I'd be worried. That's when I have the worries there.
And you don't have control of a situation?
Right. Like at work, I can't just leave.
Yeah, that leads me to, again, like I am totally going out on a limb, and I don't know what our professor will say, but like an anxiety thing.
Yeah.
But anyway.
Well, I definitely, yeah. Again, I didn't know whether I wasn't. I mean, haven't been entirely sure because it said to kind of keep it not major things, just to keep it to like stress management levels.
Yeah.
But in the grand scheme of things, I have had panic attacks big time. Like I've dealt with this for years. So I'm a perfect client.
Yeah, you have anxiety for sure.
Yeah.
You just skip this rest of this test.
Yeah, that sounds good.
What's left is the Michigan alcoholism screening test. On this test, Um, I guess is to determine whether you're an alcoholic or not.
Okay.
So it's a random series of questions. If you're willing to answer them, it'll give me a better idea of how to better diagnose you and give you a treatment plan.
Okay.
All right. Do you feel you are a normal drinker? By normal, we mean drink less than or as much as other people.
Yeah.
You are a normal drinker.
Yeah.
Okay.
Maybe. I don't know. Yeah. We'll see.
What do you mean maybe? We'll see.
We'll see. Well, I don't. You haven't defined normal for me yet. I don't know what normal is.
Well,
I guess
I don't think the
live in
Michigan test did either.
my ideas of normal. I live in a college town, and my whole family drinks. So for me, my drinking's normal. But whether that's the case in the grander society,
Gotcha. I guess it's all relative, right?
mm-hmm.
All right. Have you ever awakened the morning after some drinking night and found that you could not remember part of the evening?
No, not in the past year. Is this a whole for my whole life or?
Let me look. In the last year, I love that.
So no.
Usually such a small window. It's got to be, I think, forever. But let me look. No, I think that's just a general question. Like, not in the last. I mean, just in general.
Oh, it is?
Yeah.
Okay.
Oh, that's funny. So yeah, that's a yes. I can't even see. My glasses are so foggy. So you have awakened. Yes? No
and
or no?
Not known anything that happened the night before? No.
Okay. Does your wife or husband or parent or other relative or ever worry about or complain about your drinking?
No.
Can you stop drinking without a struggle?
Without a struggle? Can I stop drinking? Yeah, I can stop drinking.
Do you ever feel guilty about your drinking?
Yeah, sometimes.
Okay. Do friends or relatives think you are a normal drinker?
Yeah.
Are you able to stop drinking when you want to?
Yes.
Have you ever attended an AA meeting?
Yeah, when I was a lot younger for a parent of my friend, but not me personally.
Good for you. Have you gotten into a physical fight when drinking?
No.
You never gotten a scrap?
No, I never scrapped. No, that was not too. Although I'm kind of scrappy.
All right. Has your drinking ever created problems between you and your wife, husband, parent, or other relative?
No.
There's big hesitation there, but I'm going to just let that slide. Has your wife, husband, or other family members ever gone to anyone for help about your drinking?
No.
Have you ever lost friends because of drinking? That's a loaded question, actually.
Yeah.
It could be on either side.
I was thinking death. That's where my head just went.
I've lost two friends from.
I have not lost friends from drinking, though.
No. Have you ever gotten into trouble at work or school because of your drinking?
No.
Did you ever get fired because you were drunk?
No.
That's not how they worded it, but that's how I said it. Have you ever neglected your obligations, your family, or your work for 2 or more days in a row because you were drinking?
No.
Do you drink before noon fairly often?
No.
Come on.
No,
Have you ever been told you have liver trouble, cirrhosis?
No.
Ever had DTs?
No.
Gone to anyone for help about your drinking?
No.
Have you ever been a patient in a psychiatric hospital?
No.
That's the same question. I'm not going to answer that. Have you ever been arrested for drunk driving?
Yes.
That girl. Did you ask me that?
No, I did a different test than you.
Uh-huh. Have you have you ever been arrested or taken into custody even after a few hours because of other drunk behavior?
No.
Seriously?
Seriously.
Ever?
Ever.
All right. Well, as a result of our testing, points assigned, you are not an alcoholic.
Wonderful. It's good news.
That is good news. All right, now I can get, hold on. Where are you? You see me, Saul?
Mm-hmm.
I still don't see you. I haven't seen you in like an hour.
Oh.
Yeah.
Missing out.
Yeah, I have been. It's my loss.
Is that it for our assessment today?
I think so. Let me just try to see something. Yeah, did you stop the record?